Joining us today are DHS Deputy Secretary Deb Standridge and Dr. Ryan Westergaard, Chief Medical Officer in the DHS Bureau of Communicable Diseases. And we'll begin today's briefing with remarks from Deputy Secretary Deb Standridge.
Thank you. Good afternoon, everyone, and thank you for joining us today for our update on COVID-19. To begin, here are today's latest COVID-19 data and trends. As of today, 63.4% of Wisconsinites have received at least one dose of the COVID-19 vaccine, and 59.5% have completed their vaccine series. Additionally, Wisconsin vaccinators have administered more than 1.87 million booster and additional doses of the COVID-19 vaccine. Today, we are reporting 4,781 new confirmed cases of COVID-19, bringing our 7-day average of new confirmed cases to 4,679. As of today, we are reporting the total number of confirmed deaths have reached 11,293. Our thoughts go out to those of you who have lost someone to this disease. Although cases are declining, every county in Wisconsin is still experiencing critically high case activity, and COVID-19 cases continue to impact our healthcare systems, with many hospitals experiencing staffing shortages. Statewide, 92% of intensive care beds and 95% of intermediate care beds are currently in use. As of February 2nd, 1,442 Wisconsinites are hospitalized with COVID-19. 296 of these patients are in the intensive care unit. That's why we remain committed to supporting our healthcare system and want to provide you today an update on our efforts. DHS continues to work with our partners across the state to provide temporary staffing for healthcare facilities. Since October, we have recruited 813 nurses, nursing assistants, and other types of healthcare workers to support over 100 health and residential care facilities. The Wisconsin National Guard is also continuing in their efforts to support our hospital and nursing home capacity. Since last month, this effort is providing staffing support from approximately 117 National Guard members at 17 skilled nursing facilities around the state. Guard members are serving as certified nursing assistants at facilities in Antigo, Cornell, Greendale, Green Bay, Kaukauna, Kenosha, La Crosse, New London, Milwaukee, Mineral Point, Racine, Sturgeon Bay, Surin, Waunakee, Weyauwega, Wisconsin Dells, and Woodfield. The flexibility and adaptability of our Guard members has been critical in helping to ensure that patients continue to get the health care they need when and where they need it. The feedback we're hearing about this unique partnership with the Guard is inspiring, and we look forward to the next group of Guard members who will start their training soon to support more facilities. Partnerships like these are a reminder that it takes a collaborative effort on all sides to help everyone move forward. Everyone has the tools to work together in our fight against COVID-19. This includes getting your vaccination and booster or additional dose when you are eligible, wearing a well-fitted mask, staying home when you are sick, getting tested with a reliable testing provider, and following isolation and quarantine guidance. These are your best layers of defense against the virus. Thank you. And now I'll turn things over for your questions.
Thank you. And a reminder to maintain audio quality, please remain muted until it is time to ask your question. If you're able to do so, use *6 to mute and unmute your phone. And in the interest of time and to ensure everyone gets a chance to participate, we ask you that you please limit yourself to one question. And we'll begin the questions this afternoon with Rhonda Fox from WKOW-TV in Madison. Rhonda? Rhonda Fox from WKOW-TV. Okay, moving on then to David Wahlberg from the Wisconsin State Journal. David?
Yeah, thank you. Dane County has reported a case of the BA2 subvariant of Omicron, which may spread more than the initial version. I'm wondering how many cases have been found statewide, and can you give your latest assessment of what might happen with COVID in the coming weeks, given that some scientists believe Omicron may be taking us to an endemic state, while others say more variants and unpredictability are to come?
Yep. Thanks, David. The last I heard, we'd confirmed a small number, less than 5 total cases in Wisconsin of the subvariant, the BA2, as you described. I think the things to understand about this is that it is still considered the part of the lineage or the variation of that we call Omicron, but it differs with regard to a few additional mutations. So they're very closely related and seem to be behaving the same way. As you mentioned, there was a study that showed when you compare the two subvariants, the original Omicron and this new subvariant of Omicron, the rate of transmission within households seemed to be a little bit higher or a little more transmissible. There's a study from Denmark about that. So what are the implications of that for what the epidemic looks like in the coming weeks? Well, no one really knows. Both of them spread very quickly in the community. They don't seem to cause different clinical illnesses. So our expectation or our hope is that we see more of the same, which is a declining day by day, week by week from this really extraordinarily high peak that we saw from Omicron. Whether the new variation, if it takes hold, will cause that decline to occur more slowly is something that's been theorized, but we won't know until we observe it. And I think both of these variants will continue to spread in the community until there are no susceptible people left. And right now there are still some people who are unvaccinated or have been far enough away from their vaccine that they are susceptible, and people who have been previously infected have some protection, but that of course wanes over time as well. So the phrase endemic, as you say, meaning that we've sort of reached a steady state of transmission, I think that's likely to happen during this next year, but the thing we can't predict, although many people are reasonably think it's a reasonably likely expectation, is that there will be additional variants in the future that will change from a steady state to a spike that we've seen before. The defense against that is to try to maximize vaccination globally and try to prevent diseases where we find them. But that's what viruses do. They tend to evolve, and we see the same things with influenza periodically if new variants coming up. So I think the story is going to continue to be told, but we're optimistic over the next several weeks that we'll see cases continuing to decline as the Omicron surge subsides.
Thank you. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. What would you want to see reflected in the numbers before backing off on mask and distancing recommendations? Thank you very much.
Yeah, the CDC guidance, which I think is reasonable, and that we've endorsed and have sort of provided as a framework, is to look at community levels of transmission when there's low levels of transmission defined using the framework that's on the CDC website. People can no longer need to wear masks. In many settings right now, people aren't required to wear masks. Organizations and communities can sort of make their rules. So I think this is always going to be and is going to increasingly be a personal decision. But I think it's helpful to think about that in those terms, almost using like a weather analogy. When the virus is transmitting at high levels, it's going to be in our collective interests and people's individual interest to wear a mask when you're out. And then when transmission levels get low, like they were, as we were starting to see in the early and midsummer last year, it becomes less urgent to do that. And so how low is low? Well, we're still extremely high. We're 4,000 cases a day is in that critically high level. So we'd like to see it well much lower than that, less than 400, 500 cases a day. But it's, we try to look at it community by community, and people make, hopefully continue to make informed decisions about what the risk is near them.
Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for the question. For a time, testing resources got a little bit tight in the state. What is happening to ensure that there will be adequate testing resources available and available quickly going forward in the event that there's another future surge, whether that's in the next few weeks or months, or maybe even a much longer range of time? Thank you.
You're absolutely correct that the testing resources were scarce for a couple of weeks, but we have worked very hard. Our COVID response and recovery team testing team has worked extremely hard of securing new vendors and bringing additional resources in that are arriving daily. So we feel that we are becoming well-stocked and able to supply the necessary testing supplies that people need in order to complete the testing requirements.
Thank you. Now to Drew Sutherland from WSAW-TV in Wausau. Drew? And again, Drew Sutherland from WSAW-TV in Wausau. Drew.
Thank you for taking my question. So this is kind of along the lines of the supplies, like as far as testing goes. One other thing that we've been promised from the federal government was N95 mask stocks to be given out to pharmacies so they could be distributed freely. I've noticed signs up in pharmacies recently saying that they do not have any of those stocks. Do you know anything about those when they're expected to arrive?
I do not. Dr. Westergaard, are you aware? Is that's coming from the federal government? Yeah.
To get back to you.
Thank you. Now to Todd Richmond from the Associated Press. Todd?
Hi there. I don't have any questions. Thanks.
Okay, thank you. Now to Vanessa Reza from NBC 15 in Madison. Vanessa? NBC 15. Moving on then to Gabriel Mays from Fox 6 in Milwaukee. Gabriel?
Good afternoon. My question is, we keep hearing that the unvaccinated need to get vaccinated, but it appears that some people won't budge. However, here in Milwaukee, they're giving out gift cards, and that seemed to have worked to get a little bit more people vaccinated. I think the last time it was 1,000 got vaccinated. Is there more the state can do to push people to get vaccinated who are unvaccinated?
Well, I'll share my perspective. I think we hope that there is. We have not stopped trying. And I think the diversity of strategies. One is trying to provide the best information about the health benefits, both what the state is saying itself through these forums and through our messaging and media campaigns, but also trying to engage partners in the medical system. The evidence would suggest that people's individual medical professional, their doctors or primary care providers that they see are the most influential source of information in terms of people making a decision. So that's something that the state has done, is tried to equip and engage healthcare professionals to have those conversations and give healthcare systems tools to promote vaccination and have those conversations. So we try to continue to do that. Incentives for health-related behaviors do seem to work. So I don't know the details about what policies we're doing or what resources we have for that. But, I think that's probably the one clearest lesson that we've learned through the pandemic is that vaccines save lives. Unequivocally, we've saved thousands, not millions of lives across the country through the vaccination efforts that we've had. So I think the primary goal is to make sure that people understand that, to know why it's a good idea. The other piece is making it easy and doable. So getting more vaccines in more places. I think you're totally right. There are probably some people who have made their mind up that they're not going to get a vaccine, and there'll be some that we can't reach. But our goal is to try to reach as many people who still may yet decide to get a vaccine and help them do so when they're ready.
I think Dr. Westergaard is absolutely spot on. Primary care physicians, other physicians are relied on in terms of being the trusted messengers. We've got to make sure that the information we distribute that is based in science, that's based in data, that's based in evidence, and that those trusted messengers, whatever appeals to the individual that may be in the middle, not quite decided yet, or over to the other side of the fence, we're able to have a dialogue with them with the correct information, not misinformation. And it's from someone that the individual respects and is someone that they can engage in a conversation with. We need to make sure the information is accurate and out there with the trusted messengers in whatever community these individuals are at.
Thank you. Now to Alex Moe from listbusiness.com. Alex?
Hi, thank you for taking my question. So we're seeing COVID-19 cases and hospitalizations drop off, but we're not seeing as much of a decline in the number of deaths. Can you address why that difference exists? And do you expect we might start to see deaths decreasing soon? Thank you.
People who die from COVID-19 tend to pass away after a prolonged illness. It doesn't happen quickly within days. Many people are hospitalized for a week, are on life support, and then pass away when the disease gets to the point where they just can't be sustained or recover. So that, because that process takes a while, there's been a lag between the increase in cases and the increase in hospital admissions and then the increase in deaths. So I think that just in the same way that we see the case numbers go up before we see hospitalization and deaths go up, when they start to turn the corner and the event becomes less frequent, there'll be a lag. So all the evidence would therefore point to hope for in the coming weeks that we'll see declining levels of hospitalizations and deaths as the case numbers go down.
Thank you. Now to Rachel Hopmeyer from NBC 26 in Green Bay. Rachel?
Hi. Thank you for taking my question. As folks hope to receive the at-home COVID-19 test they ordered via the U.S. Postal Service last month, the boxes say that the test not be kept under 36 degrees Fahrenheit, which we can presume is a regular issue in Wisconsin this time of year. Have you guys done anything to ensure that these tests are delivered in a working condition? And how can Wisconsinites ensure that their tests are working if it's been left in their mailbox in the cold for an unknown amount of time?
So that is a good question. I don't have information about whether the federal program has made an accounting for that. So we'll have to get back to you on that. I think it's a fair point. It's likely if they're in mailbox, they're going to be at cold temperatures, but what the strategy is to mitigate that, since it was a federal program, we need to hear from them, and I don't have an easy ready answer for you unless Deb does.
Now, I've heard the Surgeon General be asked about it, but off the top of my head, I don't remember quite what his response is, but we could research that.
Thank you. Now to Chase Browning from Milwaukee Public Radio. Chase? Chase Browning? Moving on then to Mark Leland from Fox 11 in Green Bay. Mark? And a reminder, *6 unmutes your phone. Once again, Mark Leland from Fox 11.
I was wondering.
Then to Tim's. Oh, I'm sorry. Go ahead.
I was wondering, the Johns Hopkins report that came out yesterday indicating that the shutdowns really did little to prevent deaths. I know DHS was the lead agency behind the Safer at Home. Have you studied or looked into any of the effects that this had on that, and whether it was worth it to do those shutdowns? I know the numbers we're seeing now are even higher than they were at the beginning when we did have shutdowns. I wonder if you could comment on all that.
No, we don't have Wisconsin-specific analysis about the impact of stay-at-home orders during that early phase. I would say that the numbers have changed because the virus has changed dramatically in terms of being much more easily transmissible. And that's happened very clearly even since the post safer at home era between Delta and Omicron. The way the virus behaves is probably the key driver of case rates. So I have not looked at that study. I'll be happy to look it up, but don't have any comments about what that means for Wisconsin data.
Thank you. Now to Tim Stum from Wisconsin Health News. Tim?
Hi, it is my understanding that DHS has been in conversations with nursing home groups about potentially creating a fund to help nursing homes with staffing shortages, similar to a fund that has been developed in Minnesota. Is this something that DHS is considering moving forward with? And if so, what is the timeline for that?
In recent months, we have launched a number of innovative strategies to aim at addressing the workforce challenges that our residential care facilities are experiencing. We've actually increased the rates recently for skilled nursing facilities by $252 million over the biennium. We also are supplying, as we talked about in my opening remarks, the National Guard at all throughout the state in all of the 7 HERC regions. We also supply staff to skilled nursing facilities in terms of our master staffing contract, CNAs, nurses, et cetera. So that's the work that we are doing now. We engage in conversations with the local long-term care associations frequently, and we will always partner with them.
Thank you. Now to Megan Kernan from WBAY-TV in Green Bay. Megan?
Hi there. I just wanted to confirm what Dr. Westergaard said, that less than 5 cases have been confirmed of the new Omicron subvariant. And I was wondering if you can tell us where in the state these cases are located besides Dane County.
Oh, yeah, I can't. And it's good to ask for clarification because our surveillance of genetic variants is not intended to tell us, where individual cases are. They're intending to give us an idea of the proportion of all of our cases that are one variant versus the other. So I did say less than 5, but that's the number of specimens that have gone through the whole process, and that is a minuscule proportion of the overall number of cases that have been confirmed and in others that are not diagnosed. So I think the important piece to understand is that this fluctuates over time, but the presence of individual cases of the subvariant BA2 is really not the point. The point is that we follow how the virus evolves over time on a population level. I expect that we will see more, and it will always be the case that what we detect and report on are going to be a very small tip of the iceberg, because again, the genetic surveillance is a highly specialized, complex laboratory test that's done on just a small fraction, depending on how many cases, sometimes less than 1 or 5 to 10% of cases ever make it to the point where they do the specialized test called whole genome sequencing. So there's clearly many more cases than we detect. But yes, when I checked with our laboratory colleagues, they said it was less than 5 as of yesterday, with that caveat.
Thank you. Now to Philip Vadreau from Spectrum News. Philip? Spectrum News? Okay, moving on then to Emily Fannin from CBS 58 Milwaukee. Emily.
Hi there. I know at the beginning of this call, we know that all 72 counties are at critically high levels, but I guess, is there any good news that you can share as the 7-day average is significantly on the decline? Also, wastewater trends are also looking pretty good. So have we reached the peak of this Omicron, and is this good news, I guess, for us right now, looking at the data?
Yeah, absolutely. The good news is that the case counts are shrinking substantially. In two of our regions, and I pointed to our COVID-19 data pages. We have a tab called Activity Level by Region and County, and I had it pulled up a second ago. But in three of the public health regions, the cases have shrunk over the past 2 weeks by as many as 20%. So that's great news. We had a peak of 18,000 cases in a single day, and now our 7-day average is 4,000. So the good news is we're going in the right direction, and that's hopefully, as we've talked about before, good news on the horizon, that this is going to be less taxing of our hospital systems over time, although there's still a lot of people in the hospital with COVID-19. So I think that's reason for optimism, that it's things are getting better over time.
Thank you. Now to Max Cotton from WEAU TV in Eau Claire. Max?
Yeah, how concerned should people be about the new Omicron subvariant?
The best that we can tell, given the available data, is that it produces the same clinical illness as the other Omicron variant, which for most people who are vaccinated or previously infected can be an unpleasant but not a life-threatening illness. The other thing is that for people who are unvaccinated, the Omicron variant and the subvariant can cause severe disease and death. So people should, in the same way that we've urged people to be cautious and to get vaccinated and be smart about avoiding situations where you may become infected from someone who's spreading the virus, do all the reasonable things to try to avoid getting this. This isn't a virus that anyone wants. And even though there's been some good studies that show that it may, on average, cause less severe disease than the Delta variant, it has spread so quickly that there's very large numbers of people getting infected, and that has translated to a lot of very ill people. So it's not a new or more dangerous variant, but the fact that it might spread more easily means that the chances of catching it is still quite high. So right now, a lot of virus transmitting in the community, people should still, feel empowered to wear masks when you're out in public. And if people have not been vaccinated, it's still extremely important to get that extra protection with a primary vaccine series, or, as we're learning is more and more important all the time, a booster dose. Because the other thing I'll just mention about what we've learned about Omicron from some of the studies, one of the reasons that makes it spread so quickly in the community is also that it's able to evade the immune protection. So people get some protection from having been infected and recovering. They get significant protection from getting vaccinated, but that wanes over time. And the Omicron variant seems to be more able to infect someone who has some immune system protection. Studies show that when someone gets a booster dose, 5 months after their initial vaccine series, that the protection goes back up to 90%. So it's increasingly important that we talk about people and the need to be fully or up to date with COVID-19 vaccines. And for everybody over 18, that means getting a booster dose. I'm sorry, with Pfizer, it's everyone, I think it's everyone over 12 now is eligible for a booster dose.
Thank you. Now to Mason Dowling from WAOW TV in Wausau. Mason.
This is Chase for Mason Dowling. My question, like what we were saying, with cases going down and things of that nature and more people, looking at this as to be closer to an endemic. And with people, and with the hesitancy thing that you guys were talking about too, and there's some people that won't get vaccinated. Moving forward, is it important that we start investing more in treatment and making sure that we can be prepared when flare-ups do happen in the future? And as some people may or may not be vaccinated, or that, like we were just saying too, that maybe be in a period where it's waning the effectiveness and just in between boosters.
Yeah, absolutely. Treatment of COVID-19 is something that I fully expect will continue to grow, both in terms of the number of different treatments we have and the availability of treatments. And when I say treatment, I mean specifically medication, like antiviral medications to stop the virus from replicating, monoclonal antibodies that help prevent severe disease among people who may need hospitalization. There's been a lot of advances on the availability of treatment, but they're still relatively scarce. So I think in the future, the production and the development of new antivirals is going to continue, and I think we'll get to a place that resembles where we are with influenza, which is that people who we can predict based on age and the presence of chronic illness or comorbidities and vaccination status, who is most likely to have a severe or life-threatening form of COVID-19, and prioritize those individuals to get treatment. So the treatments are still very new. They're not in widespread use, but I expect that will be something that as our healthcare partners and public health evolves toward the next phase of the epidemic, we're going to need to continue to do a lot of testing for people who may have COVID-19, and when we make the diagnosis, link them to treatment that can keep them out of the hospital. So there'll be more, I think we'll see more and more of that. Right now, there's not enough treatment out there to kind of catch up to the need, and we still have a lot of people in the hospital. But going forward, I expect that to look differently.
Thank you. Now to WISN TV in Milwaukee. WISN.
Hi, this is Kent Wainscott, and a quick question regarding some news that came out of one of our local health departments today, saying that they are now no longer going to be reaching out to people who have a positive test result in the age group between 17 and 70, following that guidance, they say, from DHS, kind of a change in the protocol and outreach for positive cases. I'm wondering what we've learned over time that has triggered this sort of change in response, and whether you think this is something that is here to stay, or will health departments ever go back to the point where they're actually reaching out and contacting everyone who tests positive?
Great, Ken. I can take that one. It's a great question, a complex topic we could probably talk for a long time about, but I'll try to summarize the rationale from the early, the first year and a half of the pandemic. Our strategy was to identify every single case, investigate every single case, do contact tracing, notify people who were exposed, with a goal of as frequently as we can, knowing where the virus is spreading and trying to do things proactively to stop it. There's two reasons that we can't and are not doing that anymore. One is that with the Omicron wave, there's far too many cases to keep up with that. It's essentially impossible. The virus is moving too fast. No jurisdiction in the country has enough staff to reach out to every person. So one of it was that it just became unworkable. A second reason is that we've have a lot of other things to offer people other than investigation and notification of contacts. That piece about notifying people who've been exposed is still important, but people can feel empowered to do that themselves when they get the result back. People have become wiser and more educated about this over time and understand the importance of what it means to have been exposed. The other thing is that health departments have a lot of other tools. They have been involved in testing in the communities. They've been involved in promoting vaccination, and those are tools that didn't exist at the beginning of the epidemic, and we need to have a broader approach. And I guess the final rationale for that is really one that I could characterize as triage. We have developed a lot of skills and have a workforce able to investigate cases and interview people. We want to use those in the areas where they do the most good. And that is likely to be people who are vulnerable to severe disease, people who are elderly, or where there are outbreaks. So outbreaks in workplaces or long-term care settings. So our strategy is really shifting from one where we feel like we need to investigate every single case. That's reached a point of diminishing returns, and using the public health resources that we have in a way that prioritizes activities that are going to have the biggest impact. And that's going to be, vaccination and preparing and responding to outbreaks to protect highly vulnerable people. So we are not alone in that. I think the national organizations of health departments has signaled the same sort of transition, and it is part of our sort of transition away from pandemic mode into something that's more sustainable and focused on using the tools in a more holistic way to prevent people getting severely ill and dying from COVID-19.
Thank you. And there were a couple people who weren't available when we called on them first, so we'll try again for Rhonda Fox from WKOW TV in Madison. Rhonda? And a reminder, *6, unmute your phone. Rhonda Fox from WKOW. Okay, moving on to Vanessa Reza from NBC 15 in Madison. Vanessa?
Hi, thank you for calling on me again. My question is related to vaccine distribution. Over the past week, we saw a low amount distributed, not seen last since they first rolled out. So my question is, will there be any changes to your response in terms of vaccinated, given that these haven't necessarily rise at a high rate since they were first rolled out? And then following that, since those initial doses are slowing down, are there plans to share any data on boosters, maybe for those who've already got their first doses but are now going back for those booster shots?
Jennifer, I had a hard time hearing the first part of the question.
Yeah, and we're going to ask you to repeat your question, please. And if you could do something to increase your audio, that would be very helpful.
Yeah, so my first question is related to vaccine distribution. Are there any plans to change the way you are recommending vaccines? As the last week, we've seen a lower amount distributed, not seen since they were first rolled out. And then following that, are there any plans to share data on maybe those who have already got those first doses but are now going back for their boosters?
I am not aware of, I guess we have to need some specifics, and our media team can follow up with you. I'm not aware of any downturn in vaccine distribution. And we do plan going forward, we will be talking about boosters and who receives those, et cetera, and you'll be able to see that on our webpage relatively soon.
Thank you. Chase Browning from Milwaukee Public Radio. Chase? Chase Browning? Okay, and finally, Philip Boudreau from Spectrum News. Philip. Once again, Philip Boudreau. Okay, with that, that concludes today's briefing. Our thanks to all of you for joining us today. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Be safe and have a great afternoon.